Hi everybody. Today we are going to learn about anatomy and physiology of the respiratory system. Now let's see the respiratory tract. Air enters through the nostril into the nasal cavity, moves into the pharynx, then into larynx. From larynx it enters trachea. Trachea divides into two bronchi, and each bronchus enters the lungs, where bronchus gets divided into secondary, tertiary bronchi, bronchioles, and finally into alveoli. Looking into the respiratory tract, it is divided into upper and lower. Upper involves nostril, nasal cavity, pharynx, and larynx. And lower involves trachea, bronchi, bronchioles, alveoli, and lungs. Now let's look into each respiratory tract. Here is the nasal cavity, and air enters through the nostril. The opening of the nose is called nostril or nares. Through nostril it enters into a cavity called nasal cavity. The nasal cavity is divided by nasal septum. Inside the nasal cavity there is olfactory receptors. This olfactory receptor helps in the sense of smell. This nasal cavity also has ciliated cells, and the goblet cells and mucus gland produce mucus. So the cilia and the mucus helps to filter air from foreign particles as the air moves through the nasal cavity. It also warms and humidifies, that is, add moisture to the air. Through the nasal cavity, air moves into the pharynx. Pharynx is also called throat. It is divided into nasopharynx, oropharynx, and laryngopharynx. Pharynx close to the nasal cavity is called nasopharynx. Close to the oral cavity is called oropharynx, and close to the larynx is called laryngopharynx. Pharynx is a common passageway to both food and air. So through the pharynx, air enters into larynx. Larynx has two cartilage, thyroid cartilage and cricoid cartilage. Thyroid cartilage forms the front part of the larynx, and the prominence of the thyroid cartilage forms the Adam's apple. Cricoid cartilage is the only complete cartilaginous ring in the airway. Rest all cartilage is C-shaped, or it is incomplete cartilage. At the superior of the larynx, there is a cartilage flap called epiglottis. It closes the larynx and prevents food from entering the airways. If you look at the superior view, this is the thyroid cartilage, cricoid cartilage, and inside the larynx there is vocal cord. That's the reason larynx is also called voice box, because as air passes through this vocal cord, it produces sound. It vibrates and produces sound. And space between this vocal cord is called glottis. So through the larynx, air enters into trachea. Trachea is also called windpipe, 4 inches in length. It is surrounded by C-shaped cartilage ring. And this trachea divides into bronchi at the point called carina. Inside the trachea, there is ciliated cells, and the goblet cells produce mucus. It filters the air and humidifies the air. And the trachea is surrounded by smooth muscles. This smooth muscles helps to constrict and relax the airways. So through the trachea, air enters into bronchi. Trachea divides into right bronchi and left. The right bronchus enters the right lung, and the left bronchus enters the left lung. The bronchus enters the lung and further divides into secondary, tertiary bronchi, bronchioles, and finally into alveolar sac. This is the picture of alveolar sac, which has cluster of alveoli. This is the end point of respiration, where the gas exchange takes place. You can see the picture of alveolar sac, and it is surrounded by capillary network. This is the right lung, left lung, and the lungs are divided into lobes by fissures. Right lung is divided into 3 lobes, whereas left lung is divided into 2 lobes, 1 and 2. Lungs are covered by a membrane called pleural membrane. It's a picture of the lung, and it is covered by 2 membranes called pleural membrane. It is made up of outer parietal and inner visceral. So the space between these 2 pleural membranes is called pleural space. There is small amount of fluid in pleural space called pleural fluid. This fluid acts as a lubricant as these 2 membranes, outer parietal and inner visceral, glide during inspiration and expiration. Now let's see the gas exchange, which is the primary function of the respiratory tract. You can see the picture of the alveolar sac with cluster of alveoli, and it is surrounded by capillary network. Remember, the pulmonary artery is the only artery that carries deoxygenated blood. It originates from the heart. So the pulmonary artery carries deoxygenated blood as it goes through the capillaries that surrounds the alveoli. Oxygen moves in. When oxygen moves in, the blood gets oxygenated and carbon dioxide moves out. This oxygenated blood moves into pulmonary vein back into the heart, where the heart pumps this oxygenated blood to all organs. The carbon dioxide which moves out into alveoli is exhaled, moves out of the body through the respiratory tract. So the carbon dioxide moves out, oxygen moves in. It is a gas exchange, and this takes place in alveoli. Now let's see the process of breathing, or the mechanism of breathing. What is breathing? It is the process of moving air in and out of the body. Inspiration means moving air in, and expiration means moving air out. What are the muscles that helps with breathing? The main muscles that helps with breathing involves intercostal muscles and diaphragm. These are the 2 muscles, intercostal and diaphragm, which helps with breathing. What is accessory muscles? These muscles helps with breathing when a person needs extra help with breathing. Example, in active breathing or deep breathing or deep inspiration or expiration, or when a patient is in respiratory distress and patient need help with breathing. The accessory muscles helps with the breathing. It involves sternocleidomastoid, scalene muscles, which are present in the neck, abdominal muscles, etc. Coming back into mechanism of breathing, what happens in breathing? You can see the picture of diaphragm, which is at the inferior portion of the lungs, and the intercostal muscles are between the ribs. This muscles contracts. When diaphragm is usually dome shaped, that is this shaped, when it contracts, it becomes flattened, it becomes straight. So the space in the thoracic cavity increases. The diaphragm contracts, intercostal muscles contract. So the space increases, the rib moves upward. So there is more space in the intrathoracic cavity. As a result, the pressure in the lungs decreases. When there is low pressure, air moves into the cavity. Now let's see expiration. What happens in it? The diaphragm relaxes. When the diaphragm relaxes, it moves up. It comes back to its dome shaped. The intercostal muscles relax. When it relaxes, the rib cage gets smaller. When it gets smaller, there is low space, or the intrathoracic cavity decreases. When the cavity decreases, the pressure in the lungs increases. As pressure increases, air moves out, or air is exhaled. This involves the process of breathing. So today we learned about anatomy and physiology of the respiratory system, and thanks for watching my video.